So I just want to start off by talking about you are fully vaccinated now, right? So when did you get vaccinated and why? Can you tell me a little bit about your experience?
Yes, well, I was in line for the vaccinations like everybody else when I was eligible, and I went to the outlet in Sakanasset where the vaccinations were taking place in a large scale, and it went amazingly well. I was so grateful for and very proud of the good work that especially the National Guard was doing at Sakanasset. So I was vaccinated then in February and March, I believe, but the process went very well. I decided to get vaccinated because it's the right thing to do. Medically and morally, it's important for people to be vaccinated. And certainly for myself and for the well-being of others in the community, it was the right and the good thing to do.
Mm-hmm. I think to put it bluntly, a lot of people would be surprised to hear you say that at first response, to hear that you are fully vaccinated. What do you have to say to those individuals?
Well, I'm not sure why they would be surprised, because this is something the church has been encouraging now since this whole process began. The Pope has been vaccinated. The Catholic bishops in the United States have encouraged vaccinations. And certainly in my own statements here in the diocese and to our priest, we've encouraged people to be vaccinated. So I'm not sure why they would be surprised. As I said, it's a good thing to do and a moral thing to do for the sake of the individual themselves being vaccinated, for the people around them that they love, their family and friends, and for the well-being of the entire community. It's a very important thing to do. If we're going to emerge from this pandemic, if we're going to emerge from this crisis, this is the best way to do it. And we certainly hope people will be vaccinated, and we encourage them to do so.
How did you feel physically as well?
I had no reactions at all. I was one of the fortunate ones. I know some people have some mild reactions afterwards. I had no reaction at all, so I was very, very pleased by that, of course.
Yes, that's great. And I want to talk to you about this past year in the church. What has it been like? Can you kind of tell me, I mean, has it been tough? Has it been a challenge in the church in the past year?
It's been a very difficult time for the church, both on a diocesan level, where we've had many of our activities curtailed, meetings, liturgies, social events, but also in our parishes and our schools. It's been a difficult time for the church, as it has been for every part of our society. But I need to say at the same time, I'm very, very proud of our people and very grateful for their response. They've been cooperative, they've been patient, they've been understanding, and our priests in particular, our pastors, have done a wonderful job in doing their very best in staying in touch with people, keeping them connected to the church and to prayer. None of us expected this. None of us have been trained for this. But I think our people have been very cooperative and patient. Our priests have done a wonderful job. And our Catholic schools have been open for in-person training since last fall. And it's gone remarkably well, much to the credit of our administrators, our teachers, our parents, our students. We're very proud of our Catholic schools as well.
How do you see the vaccine really helping the church move forward when it comes to physically being there? You know, we've had so many people miss being in the church and in those pews.
Well, again, slowly but surely we've been reopening, and with the guidance of the state government, I understand there's some more restrictions being loosened even in the coming days, so we're very grateful for that. But we followed the guidelines all along, and as the guidelines are released and lessened, our churches and schools will continue as well. So the less restrictions we can put on our churches, our places of worship, our people, the more normal it will be for them. And we certainly want to hope and encourage people to come back to church. It's safe to do so. It's important for them to do so.
When it comes to the vaccine, what are you hearing from Catholic practicing parishioners?
Well, I think, I don't know that we can categorize the Catholic population any differently than the general population on this question. I think there are some people that have some moral reservations about it, or some health reservations. And of course, we don't address the medical part of that. We're not qualified to do that. But it's certainly morally safe to do it. We've encouraged people to be vaccinated. And I think the vast majority of Catholics, young and old, will be and should be vaccinated.
And I want to ask you too, because we had mentioned it earlier as well. You had said in the past to avoid the Johnson & Johnson vaccine if possible, but not if it's the only one. Are these still your feelings? We know that this vaccine is on pause currently, but if
Right.
this comes out of a pause, are these still your feelings?
Yeah, and again, when I offered those concerns about the Johnson & Johnson vaccine, I was repeating, really echoing the guidance that came from the United States Conference of Catholic Bishops, who simply were pointing out that there were some moral concerns about the Johnson & Johnson vaccine that were not present for the other vaccines that were available. But nonetheless, even in that situation, we encourage people to be vaccinated, to receive the vaccines as soon as they were eligible to do so, again, because it's the right and the good thing to do. There are some moral concerns, but I think they've been addressed very, very adequately by the Church.
And which vaccine, if you don't mind, did you?
I received the Pfizer vaccine. I brought my card along to show you. Here's the vaccination card that shows the fact that I was vaccinated back in February and March. Mm-hmm. So I feel good. I'm ready to go, and I hope other people follow the example.
That's great. And like we said, the supply is really now outweighing the demand for the first time. I think we've seen daily vaccinations drop just a bit from what we had seen across the country. And we know that, of course, religion is very important to people. Some that are aligned with certain religions may feel a little more hesitant to get any of these 3 varieties of the vaccine. What would you say to those people in your religion specifically who may feel that hesitation?
Sure. Well, if they have hesitation for medical reasons, of course, that's up to them and their healthcare provider to work out, well beyond my competence. If they have concerns about the morality of it or the righteousness of it, I would say that those concerns have been addressed. Now, at the same time, I want to emphasize that if people have concerns about this in conscience, if they are opposed to this for personal moral reasons, their concerns in conscience should be respected. The government shouldn't force anyone to be vaccinated against their conscience. However, from a Catholic point of view, any concerns about the morality of the vaccinations have been addressed many times, and I think people should be vaccinated.
Can you tell me a little bit about how the diocese is encouraging this?
Well, again, certainly through my own statements, I've encouraged people to be vaccinated in our diocesan newspaper and our comments on Twitter and comments online and so forth. Well, I've written to all the priests, I've written to the people of the diocese, encouraging them to be vaccinated. So, and I think on the local level too, some of our parishes and organizations are very open to participate in this process. And I certainly want to say also that if there's anything I can do personally or the diocese can do personally to assist the state in this effort, we're very willing and able and ready to do so. So if anybody thinks we can be of any assistance in any way to encourage this, I would certainly consider that.
We are now seeing eligibility open to everyone for the vaccine, but we are seeing that supply outweigh the demand right now, which is great to see so much available, but we are looking toward leaders to kind of help people to navigate. We did just see former President Trump come out and encourage people to get this vaccine. Do you yourself see having a responsibility in yourself to help people navigate going about getting this vaccine?
Yeah, I think it's important for leaders in the government, in the state and the city and nationally, and in the church as well, to encourage this. Because it is, when you get to the bottom line, it is an issue of respect for human life, which, you know, we're very prominent in. It's one of our primary moral concerns of promoting and defending the dignity of human life, and working to preserve and protect our health is a legitimate and important part of that. So I think the religious community, not just Catholic, but others as well, I think we have a very special responsibility, but also opportunity to encourage people to participate in this. Again, the specific health concerns are important, but it is an expression of our concern for and respect for human life. It's consistent with what we say all the time.
Mm-hmm. And if someone were to come to you today and say, I don't care what anyone says, I'm not going to get this vaccine, I don't believe in it, what would your response to them be?
Well, if someone says, I don't believe in it, I guess I would have to ask them what they mean by that. They don't believe it's important, they don't believe it's effective, they don't believe it's morally acceptable. You would have to explore that question some more and say, why don't you believe in it? Again, if it's from a moral point of view, I think we can address that, and we could do that very well. And the church has addressed it. So we would encourage people not to stay away for ethical, moral reasons. But again, if people are opposed to it in conscience, if they just don't think it's right, you should have the conversation with them. But in the end, the government shouldn't force people to be vaccinated against their will, against their conscience. But they should be encouraged and urged to think about that and to receive the vaccine.
Is there anything else that you would like to add?
No, again, it's we're very grateful that we're reaching this point where some of the restrictions are being lessened. That's a good thing for the whole community and for the church community. And we've been very patient throughout this whole process. We've tried to be good citizens. We've been very cooperative, but we're also very grateful now that we're starting to emerge from this. And we thank God for that. And again, we thank all the people who have been part of this process as well. I think they've been very patient and very cooperative.
Brighter days are ahead.
Absolutely.
All right. Thank you so much, Bishop, for your time.
You're
I
welcome,
appreciate
Lindsay.
it.
Thank you.